something that we've never done before here. And so I ask for your patience because, frankly, I'm not sure what I'm supposed to be doing. The thing is, the person who's scheduled to talk, Deborah Doctor, couldn't actually come here today. So we're going to try this experiment of working with her over the telephone. And the organizers of the conference have asked me to sit up here and relay questions or do whatever I can do to facilitate the communication between you all and Deborah. And I think, I'm told she's on the phone right now and she's ready to get going. So I'm just kind of taking the initiative and saying, let's roll and see how it goes, and I'll do anything I can to help this process along.
Hi, John. Can you hear me?
Yeah, I think we are.
She said, hi, John, can you hear me?
Oh, yes.
John,
Yes,
Deborah,
Deborah, I
can you
can
hear
hear you, yes.
Okay, great. Well, good morning, everybody, and thank you so much for accommodating me by letting me do this by phone. Is the sound okay for folks in the room?
Yes.
Yes, it's quite good, Deborah.
Okay, great. I'm going to imagine that I'm seeing you since I know a lot of you. I'm going to talk about the 1115 waiver, and because waivers are, it's not kind of self-evident what a waiver is, I'm going to assume that there might be somebody in the room who wants to know what a waiver is before I tell you about the particular waiver that is on the program for today, and I hope that's okay with everybody. The federal Medicaid program, which is called Medi-Cal in California, the Medicaid program puts conditions on states if they want to run, and they all do, a Medicaid program. They have certain rules that states have to follow, all states have to follow in a Medicaid program. Some of those things are things we don't like that you have to offer nursing home coverage, but personal assistance is voluntary, but nursing home coverage is mandatory. And there are a lot of other rules, such as if you offer a service, you have to offer it through the whole state, and that's called state-wideness. And if you offer a service, it has to be available to people who are comparably situated, who have similar circumstances, and that's called comparability. And what a waiver is, it's a way for a state to get an exception from one or more of Medicaid rules, to waive those rules. And there's nothing inherently good or bad about a waiver. It depends, like everything else, about what's actually in it. And sometimes states will waive the state-wideness requirement because they want to try some Medicaid or California Medi-Cal program, but want to do it only in one location or a few locations. Or they want to have a waiver that serves a certain population with a certain characteristic rather than offer it to everybody. So, as I said, there's nothing inherently bad or good about waivers. They've been used successfully to try innovations. California has a lot of waivers. There's about 20 waivers in effect. There are all kinds of things. There are home and community-based services waivers. There are waivers that serve people with developmental disabilities, and several more. And the one that we're going to be talking about today is called an 1115 waiver, and 1115 refers to Section 1115 of the Social Security Act. So I'm hoping that what I just said was understandable, that a waiver is an exception process. That's really all it is. In California, there has been historically a waiver so that hospitals could get so-called safety net hospitals could get financing through a waiver, and that's the subject that has been the sole subject of a particular waiver. And this year, things were done a little differently. Waivers have time limits. A state can apply for a 3-year waiver or a 5-year waiver, or there are probably other time periods as well, and then the waivers expire. The hospital financing waiver expired, I think it was the last day of August this year. And the administration and the legislature decided to do a much more expansive waiver this year, which includes the hospital financing, but for our purposes today, also includes several other topics. The one thing that it includes that I'm not going to spend any time on, but it's worthwhile for you all to know, is that it also includes the expansion through health reform. You know, Medicaid or Medi-Cal is going to be expanded to more people, which is a good thing, and that's also part of 1115 waiver. But the two pieces that I want to talk about, which I think are the ones you're interested in, are the mandatory managed care and the pilots for people who are dual eligible. I'm going to assume that you want to know about the mandatory managed care, even though it doesn't have a direct effect on IHSS, just because it affects possibly some of you in the room, and certainly a lot of people who use IHSS. You may remember, and some of you may have been involved, over the years, this administration has tried to impose mandatory managed care on people with disabilities and seniors whose coverage is through Medi-Cal. And that has been defeated in previous years, and Democrats voted against it. But this year, there was what I refer to as kind of a perfect storm. That is, the budget crisis led people who otherwise would have been opposed to mandatory managed care to believe, whether it's true or not, that mandatory managed care would save the state money. And there was this waiver expiring and an opportunity to do a more expansive waiver, and all the talk about health reform. And so this year, unlike other years, the legislature went along with the administration in getting mandatory managed care for people with disabilities on Medi-Cal. And what this means is that let me backtrack for a second. In most areas around the state, SPD, that's the unfortunate little abbreviation, seniors and persons with disabilities, somebody who's on Medi-Cal under that identification, has a choice of using fee-for-service, where you can use any provider who's willing to take Medi-Cal. And as I'm sure most of you know better than I do, it's not necessarily any easy thing to find a doctor out in the world who wants to take Medi-Cal. Under managed care, once somebody is assigned to a managed care program, all their services, at least in theory, will be provided by that managed care program, which means, in theory, you don't have to go shopping for a doctor and beg them to take Medi-Cal. So for some people, having managed care can be a very helpful thing. What's going to happen in this waiver is that there will be mandatory enrollment of seniors and persons with disabilities in managed care plans in the 14 counties that already have managed care for Medi-Cal but have been voluntary. That is, people had a choice of whether or not they could enroll in managed care. And I'm going to read you a list of the 14 counties where managed care exists and enrollment has been voluntary and will now be mandatory. And this is having to do only with people who are Medi-Cal only. This does not affect people who have Medi-Cal and Medicare. It will affect about 380,000 people, and these are the counties: Alameda, Contra Costa, Fresno, Kern, Los Angeles, Riverside, Sacramento, San Bernardino, San Diego, San Francisco, San Joaquin, Santa Clara, Stanislaus, and Tulare. Now, a lot of people put a lot of time trying to make this, and I can email you this list or tell you where to find it, trying to make this mandatory care as, how do I want to say, as not harmless, but to make it as good as it can be. And there were months of negotiations with legislative staff and the administration. And one of the really important aspects of this that was that the Department of Healthcare Services relented on under a lot of pressure from a lot of advocates and legislators was that if you have a doctor, if you're on Medi-Cal and you're on one of these counties, and you have doctors that you've been using who you like and you want to continue, you will be able to continue using those doctors even once you're assigned to a managed care plan. This was a way of preserving consumer choice. So even if you're assigned to a plan, your doctors that you like are not in that plan, as long as they are willing to be paid by the state, you can continue to use them even if they do not, are not part of the managed care plan and have no intention of being part of the managed care plan. So that was a very big concession on the part of the state. The huge issues that a lot of us pushed back very hard on were the readiness of these plans, because you know and I know that they are not all accessible to people with disabilities, and the state does not see it as its responsibility to ensure that they are fully accessible both physically and programmatically. So we know this is going to be an issue. What gets said to us is, well, there's no guarantees in fee-for-service either, which is true, but people are going to have less choice in managed care. So that's a huge issue. The mandatory enrollment, which was supposed to start February 1st, has now been pushed to June, so that's good. But the idea that 380,000 people can be enrolled over 1 year is, I just don't believe it's going to go smoothly or even be able to happen at all. We really pushed for what we call the pause button, where if things didn't go well, there would be a pause in it, but that is not going to happen. So I'm going to give you a bill number, and then I'm going to stop and see, I think, if there are any questions about this aspect of mandatory managed care. The two bills that contain the details of the managed care and the pilot program I'm going to talk about next are SB 208 and AB 342. And SB 208 is the bill that has the language about the mandatory managed care and about the pilot programs that we're going to talk about next. But I want, maybe John can tell me whether people have questions now, or you want me to go ahead and talk about the dual eligible pilots and take questions at the end.